So, good day po. I'm Ricardo Eirol. I am your nurse for today. So, for verification purposes po, may I ask your name, your birthday, and your MR number po. Okay, so for confirmation purposes, may I check your wristband? Thank you po, ma'am. So, for today po, ma'am, I'm going to assess your private part or your genitalia po. This also includes your anus and your rectum. So, the purpose of this po is to identify or reduce the risk factors associated with cervical cancers and other and across the cultures and ways po. And this is important po para po malaman po natin if there is abnormalities and deviations or irregularities po sa inyong may private part. So before anything else, should I be aware of any cultural sensitivities such as personal beliefs, cultural beliefs, religious beliefs? Wala naman po. Okay. So let us now move on po with giving you some privacy. So do you need some privacy po? Should I close the windows, the curtains, or the door? Okay. Okay, so now that I have secured your privacy po, I will now move on with the infection control, which includes the hand washing and the donning of my personal protective equipment. So first po is hand washing. There are 5 moments of hand washing. First is before touching a patient, next is after touching a patient, next is before doing a procedure, next is after doing a procedure, and next is after being exposed to the surrounding of the patient or any bodily fluids. So now that I am done with some hand washing, I will now don my personal protective equipment, which includes the gown, the mask, the goggles, the hair cap, and some clean gloves. So, wait lang po. So while I don my fresh clean gloves, ask ko lang po kayo if meron po kayo any medical history po when it comes to your private part. Wala pa naman po. Like medical records, medical history, na nagpa-check po kayo sa may private part niyo po. Wala naman po. Okay. So, wala naman po sumasakit sa inyong private part. Wala naman. Okay. So, before that po, before we move on to the assessment, it is important po talaga that you have or our patient give us consent to assess your private part. Since I am a male nurse po, it is important po na magbigay po kayo ng consent sa akin since ideally dapat po female nurse po ang nag-assess po ng female genitalia or your private part. And since I am a male nurse, it is required po na at least may kasama po kayo dito, which is thankfully you have. So again, I need your consent po to assess your private part. So, is it okay po? Okay, so there is a consent naman po sa ating patient to assess her private part or her genitalia. And meron naman po tayong kasama to assist us or bantayan po tayo all throughout the assessment. So, after that, I will gather all of the equipments needed sa ating assessment po na ito. Okay. So now that all of the things is considered and gathered, we can now move on to the assessment. So first po is the inspection of the mons pubis ng ating patient, which is this. Dito po tayo makikita ng pubic hair sa ating patient. So the normal findings po dito is dapat po there is a equal distribution po ng hair sa kanyang mons pubis, and dapat po wala po ditong pediculosis pubis or also known as crabs, and ayun po yung mga infestation na pwede natin makita sa kanyang mons pubis. And if meron pong infestation na gano'n like lice or crabs, we will take note of that po. And as we can see naman po, there are no absence and scarcity sa kanyang pubic hair sa may mons pubis. And that is good since if there is some absence or scarcity, we will take note of that po. Or if makita po natin na wala po or kukunti ang kanyang or may absence ng hair, we will ask if bago po ba siyang shave or normal ba na hindi natubo ng maayos yung mga hair niya sa mons pubis or mga pubic hair niya. Since if meron po tayong ma-inspect na deviation na not normal, we will take note of that po. And as we can see naman po, there is a normal distribution naman po. So, next naman po is we will inspect and palpate the inguinal lymph nodes po nating patient. And makikita po siya dito. And inspecting po, we can also inspect for the color. If ang inguinal part niyo po is same ng color dun the rest of her body. And of course, the main focus po is the lymph nodes. If meron pong bulging tayong ma-inspect, i-take note po natin siya. And after inspecting is we will palpate it po if yung bulge po na yon, if we feel tenderness and masses, we will take note of that po since it can be a sign of hernia po sa ating patient. So, first is the inspection. Okay. So, permission to touch po. Permission. Okay. Thank you po. So, we will now palpate for the inguinal lymph node. Okay. There is no presence of masses then during the palpation, which is a good assessment po ng kanyang inguinal part. Since wala po tayong na-feel na bulging or mamamaga or pag-lobo o pag-bulge ng kanyang mga lymph nodes sa may inguinal part. Next naman po is the inspection of the labia majora and the perineum ng ating patient. So ito po ang kanyang labia majora, the outer part. And dito po yung perineum sa pagitan po ng kanyang vaginal opening or yung may vulva and the anus. And dito po we will inspect for some lumps, some tumors, and again, some bulging. And of course, we will check din po if there's infestation, since if meron po infestation sa mons pubis niya, it can go down po here. We will also check po for the symmetry ng labia majora ng ating patient. And we will also check for the presence of lacerations or yung mga injuries or sugat po sa ating patient. So as we inspect, as we can see naman po after the observation during the inspection, wala naman po tayong nakitang laceration sa kanya labia majora and sa may perineum. Ang kanya naman po is symmetrical. And there are no lumps. Very good assessment for the labia majora since wala po tayong nakita any abnormalities. Let us now move on with the inspection of the labia minora, clitoris, the urethral meatus, and of course, the vaginal opening. So, for us to inspect po, we will observe po the labia minora, which is in here. The clitoris is here, yung para siyang small p. Next naman po is the vaginal opening and the urethral opening. Doon po natin makita ang urethral meatus. So, for the inspection po ng labia minora, we will inspect po for the folds po ng kanyang minora, ng kanyang labia minora, and we will check for the symmetry. Okay naman po ang symmetry niya. And then, of course, we will also check for some lacerations or cuts. And makikita naman po natin na normal po ang kanyang labia minora. Ang labia minora po niya is symmetrical, smooth, and somehow wrinkled po siya. And it is unbroken din naman po. And it is slightly pigmented po. Next naman po is the clitoris. Ito po yung small p po. Dito po sa may upper ng kanyang urethral opening. And ito po yung parang kung sa lalaki po is penis. Ito po yung bibigay ng parang erectile feeling po sa ating mga patient na babae. And we will check po if there is redness po sa kanyang clitoris and if there's an enlargement or and makikita naman po natin then there is none, which is a good assessment po for the clitoris. And as we can see, nasa tama naman po siyang posisyon. And we will take note of that as a good assessment for the clitoris. Next naman po is the urethral meatus. Ang urethral meatus po na ang patient na babae is above its vaginal opening, which is dito po. And dito po we will inspect if meron po siyang discharge. Since if there's discharge like blood or whitish stain or even yellowish stain, we will take note of that po as a condition po ng ating patient. Okay, so now let us inspect it. Okay, so after the inspection naman po, wala po tayong nakikitang urethral discharges sa kanyang urethral meatus. So that is a good assessment of the inspection of the urethral meatus. Lastly po is the inspection of the vaginal opening. So ito po ang vaginal opening na ating patient. So sa vaginal opening po, dito po kadalasan na nangyayari yung pagpasok po ng penis if there's sexual intercourse po within a couple or within two persons po. And this vaginal opening po, dito po lumalabas ang blood or menstrual blood ng ating patient. And dito rin po lumalabas ang baby. So, in the inspection po, dapat po wala po siyang redness. And ang normal vaginal opening po, it can vary in size. But, normal po na ganito po ang size ng vaginal opening na ating patient. So, dapat mo wala po siyang redness or change of appearance. Dapat po wala po sa kanyang redness or change of appearance, since if meron man po, it can be a sign of HPV and we will take note of that po. Next naman po is the palpation of the Bartholin glands and the urethra. So, the area po of the Bartholin gland is the lower portion po ng labia, and we will palpate it po between our thumb and our index fingers. We will do this po by placing our index finger inside the vaginal introitus and palpating po using, again, our thumb and our index fingers. So, okay, palpating na po. Okay, so based naman po sa ating assessment, normal naman po assessment natin or normal ang ating findings sa kanyang Bartholin glands, and wala po tayong feel na tenderness doon. While now po is the urethra. Po ang urethra naman po, ito po yung pinilalabasan ng urine na ating patient from the bladder. So let us now palpate it. We will do the palpation po by inserting our index fingers into the vagina and then gently milking the urethra by applying pressure up and out. This procedure po should not produce any pain, and if meron po any discharges is dapat po i-take note po natin yan. So now I'm going to put some lube in my index fingers. Then we will use our other hands para po hawakan dito. And permission po pala. Permission, okay? Then papasok po natin sa may vagina and milk it. Okay. Okay. So, after the palpation po, wala po tayong nakitang discharges sa urethra, which is a good assessment. Next naman po is we will inspect for the size of the vaginal opening and the angle of the vagina. So, ang size po ng vaginal opening, it varies in size po as mentioned earlier. But as we inspect po, dapat po ang size niya is within normal size, which is 2.5 to 6.5 centimeters. So, as you can see, okay, normal naman po ang size niya, which is good. Next naman po is the inspection of the angle of the vagina. So, ang vagina po, it is a tube that connects the vulva and the uterus. So, typically, it runs obliquely upward and backward at least 45-degree angle. So, as we inspect naman po, it is in a normal angle po ang kanyang vagina. So, next naman po is the inspection of the cervix po. Kadalasan po sa pag-inspect ng cervix ng ating patient, we use acetic acid po for our naked eye to examine po clearly ang cervix or the uterine cervix ng ating patient. In a normal inspection po, we apply 5% of acetic acid para po ma-interpret natin ang result po ng cervix inspection natin ng cervix nating patient po after a minute. This is a simple and inexpensive test po for the detection of cervical or cancerous for the detection of the cervical precancerous lesions and early signs of cancer po sa may cervix nating patient. Okay, acetic acid. Then after a minute, makikita po natin ang result. So, in this examination po or inspection, If the cervical epithelium contains a abnormal load of cellular protein, the acetic acid coagulates po a protein conferring in an opaque and white aspect of the concerned area. And if meron pong ganon, we will take note of that po. So now po we'll inspect the vagina. Since nasa loob pong vagina, we can ask the patient to, at least with gloved hand, is i-open niya po yung kanyang mga labia for us to see the vagina, or we can do it ourselves. And then we will inspect po ang abnormal findings po natin dito is if we saw some masses, induration po inside of it po. So, permission po ulit. Okay. Okay, so there are no abnormalities naman po, no redness, no masses, no indurations na dapat natin kamahalan. So now naman po, we will palpate the vaginal wall, the cervix, the uterus, and the ovaries. So in this po, we will use both our hands, since we will put our other hand sa may lower quadrant po, or sa may abdominal lower quadrant here, sa may malapit sa mons pubis. And isa po is yung pang ipapasok po natin sa may vaginal opening po na ating patient. We will put lube po here para po hindi po masyado masaktan ng patient in palpating the vaginal wall, cervix, uterus, and the ovaries. Dapat po sa mga na-mention ipapalpate, wala po tayong ma-feel na enlargement, swelling, and dapat po tama po ang mga sizes or length pag papalpate po natin sa mga vaginal wall, cervix, uterus, and the ovaries. Especially po pag sa ovaries, dapat po wala pong enlargement tayo mafe-feel. Vaginal wall, wala po tayo mafe-feel na mga bulges. Of course, sa cervix, dapat wala po tayong mafe-feel na at least, or mafe-feel na discharges. Pero na lang if nasa menstrual period po ang ating patient. So, let us now do the palpation. So, here po sa may lower quadrant. And of course, with the permission po from our patient, permission po na ipalpate using my fingers. Okay. Lube, I'm going to put some lube para po hindi po masyadong step. Okay, so may abdomen, lower quadrant, and then ipapasok mo na po. May labog malalim. Okay. So, sa pagpapalpate naman po ng uterus sa ating patient, it is firm naman po, smooth, movable, and non-tender. Maayos naman po ang kanyang consistency. So, parang plum size naman po ang kanyang uterus. Wala naman po tayo na-feel na enlargement and swelling. As well as sa kanyang vaginal walls, sa cervix, and the overall palpation is a good palpation and a normal assessment. So ovaries po, wala po tayong na-feel na presence of mass, presence of adnexal tenderness, which is good. So it is a good assessment of the ovaries. Now po, for the assessment of the anus and the rectum, first po we will inspect the perineal area po nating patient. Since na-inspect na po natin yung perineum kanina, wala naman po tayong makita abnormalities and irregularities sa may perineal area po niya, which is, we will take note of that as a good assessment. Wala po tayong nakikitang mga lacerations, which is good, since walang mga cuts na nakikita. Wala po tayong nakikitang laceration, excoriations, mga sugat-sugat, which is good. Next naman po is we will inspect, or we will now palpate the anus and the rectum. So sa anus po, again, we will now palpate for some tenderness. Dapat po smooth lang po ang anus. Dapat po ang anus po natin is free of lesions, lumps. Dapat po wala din po tayong makitang warts here. And sa pagpapalpate po natin, dapat smooth lang siya. And dapat po wala nga tayong ma-feel na aforementioned conditions like yun nga, lesions. So, kung wala palpate, permission po. Okay, that is a good assessment po ulit ng ating anus, since wala po tayong feel na any bad assessment po or wala po tayong na-feel ng mga aforementioned conditions. And lastly, we will palpate for the rectum of our patient. Dito po, we do this to check or feel for some hemorrhoids. And people do the palpation of the rectum to check po if there's some anal pain, constipation, pelvic pain, or if there are bowel or urinary continence. So, dito po is I'm going to put some lube sa aking fingers para po hindi po masakit sa pagpasok po na aking fingers sa kanyang anal rectum. And again, we will inspect for acute appendicitis or meron po siya inflammatory bowel disease. Lahat po yan is makikita through the palpation of our rectum. So, let us do this po. Since dito po makikita natin if there are pelvic pain, uterine or ovarian cancers, gastrointestinal bleeding, hemorrhoids, uterine fibroids, acute appendicitis, and even rectal polyps and inflammatory bowel disease. So, now I'm going to put some lubricant. Okay, so nga lang po tayo malalim, mabilis lang po ito. I'm just going to palpate the rectum to check for the aforementioned conditions. Okay, inserting it now. Okay. So, thank you po. After the palpation, wala naman po tayong feel na any bad findings sa kanyang rectum. And that is a good assessment po ng kanyang rectum. So, overall po, that is a good assessment of her rectum since wala po tayong nakitang abnormalities and irregularities during the palpation. So, now that we're done with the overall assessment, I will now document all pertinent information na important po sa nursing form. Okay. Then, I will dispose all the things na ginamit po. And I will discuss the holistic nursing care sa ating patient, which includes not only your physical aspect po ang aming binibigyan ng care at pagpapagaling, but also your spiritual, social, mental, and psychological aspects. So, always remember po na all of those aspects po is dun po kami nakafocus always. So, thank you po for your time, your permissions, your consent, and thank you po.